So another set of really interesting sources that I've been working with at the World Bank are about the Onchocerciasis Chemotherapy Fund. So this was a fund created in the 80s by the World Bank and the World Health Organization, and they were really interested in trying to find a way to develop a macrophylaricide, so a way to actually kill off the worms, the adult worms within humans that cause river blindness. Although later it turns out they got something called ivermectin, which you might have heard about. It was developed by Merck, the pharmaceutical company, and this was actually used as a microphylaricide. So it's used to treat the larvae that actually cause a lot of the symptoms living within humans of river blindness. And so what I'm interested in is, how did the chemotherapy fund decide when to fund clinical trials? How did they decide where to go? Was there donor support and stuff that was involved in selecting facilities and people on which to test? How do you decide how many people are enough to test something on? So there's a lot of kind of epistemological and ethical questions that come in. And some of the sources that I found at the World Bank are really valuable in kind of entering some of these debates and in identifying people that you might want to talk to during the debate. So on these next few slides, I'm just showing you examples of some of the files that I found on the Onchocerciasis Chemotherapy Fund from the 80s. You can see a lot of handwritten notes between colleagues kind of saying, well, this research group might be useless, or here's somebody we contacted at Merck. And so you can really kind of get a gaze in onto the story without quite the retroactive triumphalist lens that we often apply to the Merck donation of ivermectin, which is kind of seen as one of the best philanthropic gifts in the history of public health. As an example of some of the fun files that I discovered within the archives, you can see right here, this is in the Italy donor files, and there's actually a number of letters from Robert McNamara and other World Bank staff, and they were interacting during the early 80s with Italy, which was a new or prospective donor to the program, and so they actually used the film that I just discussed to try to kind of bring in collaboration, but they had a big debate over tying of aid. So the idea, you have a trust fund here, and some countries that got involved, they wanted to negotiate ways to earmark within this trust fund system. And so Italy was saying, yeah, we'll get involved, but only if maybe we can have certain contracts that will go to us for insecticide spraying, that sort of thing. And actually here, it was really interesting to see the World Bank's response and how firmly they were saying, no, we're not doing that in this program. So really setting a prototype within this program. And some people say this is because Robert McNamara had such a strong personality, and he was really able to bring together executive directors within the World Bank and really able to say from the very start, we're not tying. So I hope you enjoyed this kind of sneak peek into the World Bank archives. I really had an amazing time over the week working with the World Health Archivists, and I'm very grateful for their support, and I really look forward to continuing to work with them. And over the next few months, I'm going to be talking about the visit that I just conducted to the UNDP, the United Nations Development Program's archives at the UN office in New York, where I learned quite a bit about socioeconomic justification and some of the ways that the bank and the UN wanted to marshal this program as a showcase for how you can measure the socioeconomic impact of disease control. So those are coming soon, and really thank you for watching. I'll be back in touch.